Underground fat loss peptides have freaking exploded over the last few years. I know you guys have been seeing this from gym lockers to Reddit threads to TikToks. Everyone's talking about these compounds. Every few months, it seems like a new peptide comes out and promises better fat loss, better results, better muscle protection, mechanisms that sound scientifically legitimate. But the challenge is not finding these peptides anymore. It's actually cutting through the bullshit, cutting through the noise to know what's actually backed by research, what are just the mechanisms that we're comfortable with prescribing these prescribing doctors, and what are people actually experiencing. If you're trying to use fat loss peptides, then this video is for you. I'm Dr. Jones, DC, and I lead the coaching department at our nationwide peptide and GLP-1 telemedicine clinic, where I actually coach thousands of patients on peptides for fat loss and overall health optimization. You see, this passion of mine comes from my own 20-year battle with obesity. I've been exactly where you are, and now I work alongside my medical practitioners, helping people navigate this space safely. Today, I'm breaking down the 4 most talked about underground fat loss peptides. For each one, I'm gonna show you what people are actually saying, what the biology actually is, what the research shows, the good and the bad, and what the real picture looks like. Then I'm gonna show you some medically supervised options as well, kind of things that we prescribe every single day. All right, let's see what the data actually says. Let's start with the most widely discussed fat loss peptide in the underground space, Cardarine. Cardarine, or GW5015, the interest score on this one is 4 out of 5. Endurance athletes swear by it, and it's WADA banned, so it must work, right? Here's what the people are actually saying. It's like the second or third lung effect. That's most consistent. Users are finding that what describes like a 20 to 30% increase in cardio capacity. Though these aren't from controlled studies, these are just anecdotal reports. Effects are noticeable within 3 to 7 days, smashing personal records in running, cycling, rowing. And here's the fat loss piece. You're burning more calories through increased endurance without appetite suppression. Minimal side effects at 10 to 20 milligrams per day. No hormone suppression, no post-cycle therapy needed. I get the appeal. Imagine cutting 2 to 3 minutes off of your 5K times or training 30% longer without feeling that normal fatigue. For fat loss, you're increasing your body's ability to burn fat as a fuel. Clean mechanism, no hormone disruption, oral convenience too as well. It's a big deal. All right, let's get into the mechanism now. Cardarine flips the genetic switch in your cells. It tells your body to burn fat for fuel instead of sugar. Think of your mitochondria, the tiny power plants or batteries inside of every cell. Cardarine makes them multiply and gets them way more efficient at burning fat. And the result, your body preferentially burns more fat for fuel during exercise and during at rest. So your endurance skyrockets. And in rodents, this produced a 68 to 69 minute increase in running time. That's near doubling endurance capacity. So what does the research show? Human testing in the second stage of drug development confirmed favorable metabolic effects. Decreased triglycerides, increased HDL, that's the good cholesterol, improvements in insulin sensitivity, and it was well tolerated in the short term. But development was actually abandoned in 2007. See, here's the problem. Long-term rat studies showed tumors in multiple organs, liver, bladder, stomach, intestines. The lowest dose that caused cancer in rats translates to about 35 milligrams per day in humans using standard dosing calculations. Recreational use is 10 to 20 milligrams per day. Those ranges somewhat overlap. They're too close for my comfort. Though human equivalent dose calculations certainly involve some uncertainty and just mechanistic guesses. So why did the development stop? See, GSK had billions of dollars on the table with obesity and diabetes markets. They walked away because the margin of safety was just too narrow. The cancer latency issue is very serious. Cancer takes 5 to 25 years to develop. People cycling Cardarine for 8 weeks in 2025 won't know if they're safe until 2030 to 2045. You're running a decades-long experiment on yourself, and again, I wouldn't touch this with a 10-foot pole. User reports are consistent. 99% mention dramatic endurance enhancement. The mechanisms clearly works, but nobody's reporting cancer yet. But as one user said it, as far as I know, I don't have cancer. So interesting perspective there. Clinical judgment here, the fat loss and endurance mechanisms are real, but the cancer risk is unresolved. GSK's decision to abandon the development, despite massive commercial potential, is the loudest safety signal that you'll get. By the way, if hearing decades-long cancer uncertainty is making you realize that you need professional guidance because you really don't know what the hell you're doing, not underground gambling, we offer free discovery calls where you can actually speak to our patient advocates to help you address your specific situation and create a personalized, safe fat loss protocol. I'll leave a link in the description, or you can just text the number on the screen to book that call. Okay, BAM15, the mitochondrial uncoupler. Interest score 2 out of 5. Newer to the underground scene, but it's rising in the biohacker communities. What are they saying? Low-grade Furnace mode around the clock. Fat loss without appetite suppression. visibly leaner physique over 3 to 6 weeks, constant warmth, night sweats, increased sweating, some energized, but many fatigued. I get the appeal. It's a completely different mechanism from appetite suppressants. You're increasing energy expenditure directly, burning more calories 24/7 without changing food intake. Jennifer, one of our patients, thought she was eating healthy, but her blood sugar stayed elevated. BAM15's appeal? Increasing metabolism without changing her diet. Let's get into the mechanism. BAM15 is a mitochondrial uncoupler. Essentially what that means is it disrupts the way that your batteries operate. Your mitochondria make ATP, which is like the gasoline for your cells. BAM15 makes them leak energy as heat instead, like a car with a hole in the gas tank that has to keep refilling. Your cells compensate by ramping up the metabolism because you have an energy demand that your body needs to meet. The net result, you burn more calories, you oxidize more fat 24/7. Key safety innovation? See, there's an older mitochondrial uncoupler, you probably never heard of it, called DMP. That literally killed people by raising their body temperatures uncontrollably, cooking them from the inside out. This is no joke. BAM15 doesn't cause that sort of hyperthermia, increase in temperature problems at therapeutic doses, and that's the breakthrough. What does the research show? The mice data, 20 to 27% weight loss, 30 to 34% fat reduction, and it preserved the muscle on your body. Phase 1 human trials are favorably safe, no serious adverse events. Phase 2 is ongoing for fatty liver disease. A 2023 study actually showed that it stacked well with semaglutide, 100 to 200 milligrams per day, very manageable, over 150 milligrams, intense warmth, sweating, and anxiety. Of course, the dose-dependent thermogenic effects are going to vary. Why this one is different? Unlike others, you see BAM15 is active in clinical development. Phase 2 is enrolling, pharmaceutical companies are still investing. But here's the catch. No published human efficacy data just yet. Gray market meaning purchased from unregulated sources means unknown purity, expensive $200 to $400 for 10 grams. Dosing is in trial and error is likely. Our clinical judgment, most promising of all 4, robust preclinical data, active development, phase 1 safety favorable, but you're beta testing without human efficacy data. I rank this one for future potential. BAM15 is number 1. But future potential means waiting for phase 2 data, at least at the very minimum, not experimenting now. If you're realizing that even the most promising underground compounds are still a little scary and you're not really sure what to do, hit that subscribe button right now because we put out 2 videos every single week breaking down what's actually backed by long-term safety data, what the mechanisms say, and what are doctors prescribing currently as of today, despite the lack of human data that we would like. Hit that subscribe button right now because it also helps out the channel too as well. Now there's Adipotide. Interest score on this one is 5 out of 5. The compound that ended its own development. What do we mean here? Stay tuned. What people are saying, the most potent fat loss mechanism ever studied. Fat literally melting from stubborn areas. 5 to 12 pounds in 2 to 4 weeks. Continued fat loss even after stopping the holy grail that pharmaceutical companies unfortunately abandoned. I completely understand the appeal. Sarah, one of our patients, had actually escalated her protocols to the maximum dose, tried everything of her GLP-1s. She tried everything, she was stuck. When she found posts about Adipotide showing 38% fat reduction in just 28 days, she thought, this is it. She almost freaking ordered it, $600 before giving our clinic a call. Let's get into the mechanism here. Here's what makes this one so different. Adipotide targets the blood vessels that feed your fat cells. It actually kills those blood vessels. Fat cells lose their blood supply and they end up dying. Think of it like cutting off the supply lines to an army base. No supplies, no base. Your body ends up clearing the dead fat tissue out. The fat cells are gone permanently, not just emptied. You're not burning fat or suppressing appetite. You're eliminating fat cells. That's why this is so potent and so promising. But the monkey data from 2011, 11% weight loss, 38% fat reduction in monkeys in 28 days. This was aggressive, targeted fat elimination. The mechanisms worked exactly as designed. But, there's always a but, there was a problem. Kidney damage markers appeared at every dose that worked for fat loss. See, your kidneys have the same receptors that Adipotide targets in fat tissue. You can't hit the fat without hitting the kidneys. It's built into how it works. Human trials in 2019 enrolled participants, they found kidney damage and permanently terminated all trials. They didn't pause it, they terminated. The pharmaceutical industry said no safe dose exists. That's a little scary when the pharmaceutical companies say, yeah, this was too dangerous. The underground continues anyways. Despite termination, people still use it, which blows my mind. And there was a high-profile bodybuilder death in 2022 involving kidney failure. He was known to be using Adipotide among many other compounds, making direct attribution complex, but the kidney failure connection can't be ignored given the documented kidney toxicity. Clinical judgment here, the mechanism is brilliant, the fat loss data is real, but the kidney damage at every effective dose means stay the hell away from this one. This one is off the table. The pharmaceutical industry walked away from billions in potential revenue. Smart choice. That's the loudest safety signal that you're gonna get. Please do not use this. By the way, if you've already bought any of these underground peptides or you're seriously considering it, describe your situation in the comments, what you're hoping to achieve, and why you've been drawn to the underground route. I'll share what we recommend for your specific situation based on what I see in our clinic. No judgment here. I've just seen thousands of patients in similar situations, and I want to help you navigate this safely. Last one up, Melanotan II. The interest score on this one is 4 out of 5, most widely used underground peptide. Here's the fat loss angle. Appetite suppression without the GLP-1 nausea. People report significantly reduced hunger, making calorie deficits way easier to achieve. And here are the bonus effects. Rapid tanning, enhanced libido, non-hormonal. Pretty awesome, right? It's marketed as multiple benefits in a single compound, and I get the appeal. Jessica, one of our patients, lost 35 pounds, but felt soft and flabby. Her DEXA scan showed lots of muscle mass loss. She wanted appetite control without affecting her hormones. Melanotan II's appetite suppression without being hormonal seemed perfect for her, plus the other benefits felt like bonuses. Okay, let's get into the mechanisms here. It activates receptors in your hypothalamus, which is a small structure deep within your brain that controls hunger and fullness. It suppresses those hunger signals. That's the fat loss piece. It also hits receptors in your skin cells for tanning and affects sexual function pathways. One compound, multiple pathways. What the research shows though, early human safety testing confirmed that the appetite suppression works. But here's the problems that emerged. Early human safety testing showed nausea in 22-26% of users, similar to GLP-1 rates, but not as good appetite suppression. While some users reported persistent nausea, it typically was dose dependent. So you're not necessarily avoiding nausea with this, like many people think. You're trading GLP-1 nausea for melanocortin-related nausea, the pathways that it works on, plus adding other risks. The serious concerns are real. Painful, prolonged erections, if you're a man, requiring surgery in some cases. There's some documented cases of a young woman who actually developed melanoma, skin cancer, after using Melanotan II with tanning beds. While causality wasn't proven in that single case, the combination of UV exposure and stimulating all those melanocytes, including potentially cancerous ones, presents a real theoretical risk. Underground products have been found to contain contaminants, impurities, and undeclared substances. Without pharmaceutical grade quality control, purity and safety just can't be guaranteed. So why did the development stop? The side effects made it unacceptable. They created an FDA-approved version, called it bremelanotide, which is specifically designed for sexual function with better safety, keeping the benefits people wanted while eliminating the dangerous risks. Our clinical judgment, for appetite suppression, proven GLP-1s work better with manageable side effects if you do them right, and of course you're gonna get pharmaceutical grade quality. You're not necessarily avoiding nausea with this one, you're trading one source for another, plus you're adding that melanoma risk and contamination concerns. I think we know the answer to this one. So that's the underground landscape here. 4 compounds, all abandoned by pharmaceutical companies who had billions on the table. That should tell you something here. But here's what those same companies kept developing because the risk benefits made sense. Everything that I'm about to show you isn't a compromise, it's an upgrade. Better results, actual medical oversight, no kidney toxicity, no cancer latency questions, no contamination risks. Everything here is either FDA approved or available through a physician-supervised compounding pharmacy with pharmaceutical grade quality control. So let's start with the foundation here that most people skip. Before we talk about any peptide, we need to address thyroid function. Thyroid hormones are a major regulator of your metabolic rate and your energy expenditure, the amount of calories you burn at rest. When thyroid function is impaired, your metabolism slows down significantly. You can't out-peptide a broken thyroid. The problem with standard testing though, most doctors only test for TSH. Your TSH is 3.5, you're told you're fine. But that doesn't tell us if you're making enough active thyroid hormone. If conversion isn't working, or if you have autoimmune issues attacking your thyroid, aka Hashimoto's, then you're kind of screwed. Our complete testing reveals which approach you need. You gotta get a comprehensive test. TSH, which signals to your thyroid, free T4 and free T3, which are actual thyroid hormones, reverse T3, which actually can block thyroid function when elevated, and thyroid antibodies to show any potential autoimmune attack. Proper testing allows medical providers who know what they're doing to accurately assess and only prescribe medication when it's actually needed. In Nancy's case, metabolic restoration 60-year-old grandmother lost 30 pounds, then stalled eating 1,100 calories. She was cold all the time, freezing indoors, brain fog, zero energy. Her thyroid actually down-regulated. It slowed down from undereating. So we gradually increased her to 1,800 calories over a 4-week period. She ended up losing 2 pounds during the reset, and then she lost 2 pounds per week afterwards. Her thyroid labs normalized naturally, no medication needed. But understand that some people do need thyroid medication, and that's where the comprehensive testing and consultation approach makes sense. It makes all the difference. The right testing identifies whether you need metabolic changes, medication, or in some cases even both. This is the foundation. Please don't skip it. If you do this first, everything will work so much better, all your peptides. Now let me know in the comments, should I make a dedicated video on thyroid optimization for fat loss and how it plays with your peptides? I'd walk through our complete testing protocol, not just the TSH, but what all those individual markers mean, and show you exactly what we do when patients plateau despite doing everything correctly. Let me know in the comments if that'll be helpful for you or not. Now, let's talk about some pharmaceutical grade fat loss peptides, the stuff that we confidently put our stamp of approval on and my doctors prescribe every day. Tirzepatide, Semaglutide, these aren't underground experiments. They're backed by trials with over 28,000 participants, years of safety data, FDA approval for obesity and diabetes, and many indications probably around the corner. The data is unprecedented. Tirzepatide, 22.5% weight loss at 72 weeks. Semaglutide, 15 to 17% weight loss. A massive cardiovascular outcome study called the SELECT trial showed that 20% reduction in heart attacks and strokes. Compare that to underground peptides with no human data or abandoned safety concerns. This is real obesity treatment. The mechanisms are very straightforward. GLP-1 mimics your body's natural satiety hormone, slows gastric emptying, increases fullness, reduces food noise. This is massive, that constant mental chatter about food. Tirzepatide adds a dual mechanism, which is one of the reasons why it gets better results. What makes these two different? Pharmaceutical grade quality, not gray market powder. Of course, medical supervision, proper dosing, side effect management, that's all gonna matter. There's possibilities of insurance coverage too as well. Compounding pharmacies, which are licensed to custom make the medications, offer lower cost options. John came to us taking 2.4 milligrams of semaglutide, the maximum dose. He wasn't losing weight anymore, he was completely stalled. To put that into perspective, normal and optimal should be closer to the bottom of the range, like closer to 5. He was nearly 26, way higher. His insulin resistance was so severe that even the maximum dose GLP-1 couldn't overcome it. We addressed his hyperinsulinemia, those elevated insulin levels, through fasting and metabolic work. And once those chronically insulin levels decreased, we restarted him at a lower dose. He ended up only needing 5 milligrams, and it worked better. See, it's not about the dose, it's about the foundation. Now, do you need this medication for the rest of your life? Well, I think it's case by case. In our clinic, our goal is to get you to a microdose, but we're only gonna do that by implementing strategic lifestyle interventions. The goal is not tapering off, the goal is building some independence. But you can't ignore protein. 1 gram per pound of target body weight. You gotta resistance train 3 to 4 times per week. The goal is to gain muscle and maintain the muscle mass that you have on your body. The side effects aren't bad when you stay on low dosing strategies. So why does this beat underground approaches? Pharmaceutical grade quality versus unknown purity medical issues, tens of thousands of patients, years of safety data versus anecdotes. You're not gambling here, you're getting proven treatment. Now we're getting into peptides that work through different mechanisms from GLP-1s, those that don't suppress your appetite. They actually directly enhance fatty mobilization. AOD 9604 and SLOOP 332. These can be stacked with your GLP-1 medications under medical supervision for some powerful results. Both are available through physician-supervised compounding pharmacies. AOD 9604 is actually a growth hormone fragment. It's a piece of the human growth hormone that retains the fat loss properties without other growth hormone effects. It stimulates fat breakdown and inhibits fat storage. No effects on blood sugar or insulin at all. It was investigated for weight loss in the early 2000s, but failed to show significant weight loss. I'm gonna show you exactly how you get weight loss with this one here shortly. It was never FDA approved. Early studies showed modest effects, but it was very safe. In fact, it was on the FDA safety list originally too. Still available via compounding pharmacies, it is considered an investigational product. What do we see clinically with this? Enhanced fatty mobilization, especially those stubborn areas when you stack it with fasting protocols. And guess what? The synergistic effect of the GLP-1s, they make fasting easier. Different mechanism, double the results. Typical dosing could be anywhere between 200 to 500 micrograms, injected underneath the skin, about 5 to 7 days per week. Gradually recomping the body over 3 to 4 months, well-tolerated, minimal side effects. Okay, SLOOP 332, the mitochondria enhancer. This one works by regulating your body's internal clock, your circadian rhythm. This will increase the mitochondrial function, it'll enhance fat oxidation, improve metabolic flexibility. Now here's where it gets powerful. When we stack AOD 9604, SLOOP 332, and GLP-1 together, you are hitting fat loss from multiple angles. Very, very powerful synergistic effect. GLP-1s will handle the appetite, AOD will mobilize the fat, and SLOOP will enhance your mitochondria and cause you to burn more calories at rest. Remember Jessica from earlier? She lost 35 pounds, but 15 of it was muscle. We ended up adding this stack to her Tirzepatide protocol alongside 150 grams of protein and resistance training 3 times per week. 6 months later, she gained 8 pounds of muscle and lost another 10 pounds of fat. The scale barely moved, but her body completely transformed. That's what happens when you stack complementary mechanisms with proper peptide foundations. Why this beats underground? See, pharmaceutical grade quality from compounding pharmacies, medical supervision and dosing guidance, regular monitoring, legal access with prescription, known purity and concentration. MOTS-c, the mitochondrial-derived peptide. This is something that your body naturally produces, and as we age, production declines. Supplementation of this peptide aims to restore youthful function of your mitochondria. Remember, think batteries of your cells. What it does, it improves how well your cells are going to respond to insulin. It enhances the overall function of those batteries. It increases metabolic flexibility. The anti-aging properties go beyond just fat loss, particularly valuable for patients with insulin resistance and metabolic syndrome. The mitochondrial health connection. Think of the mitochondria as your cellular energy factories. MOTS-c improves the factory's efficiency. Better energy production equals better metabolic function, which equals enhanced fat loss capacity. What are we seeing clinically? Improved energy levels and exercise capacity, enhanced insulin signaling, better glucose control, synergistic with other metabolic interventions. Typical dosing, 5 to 10 milligrams injected underneath the skin 2 to 3 times per week. This isn't a standalone fat loss peptide. It's a foundation compound that improves how your cells produce energy, making all your other interventions work that much better. And it's available through compounding pharmacies. Of course, medical supervision is required. Okay, I want to hit this last piece and have you understand the inflammation connection. This isn't intuitive for most people, but chronic inflammation directly impairs fat loss. Inflammation drives insulin resistance, makes you more susceptible to cortisol, and makes your body resistant to metabolic change. Before we chase fat loss, we need to address inflammation. Maria, 45-year-old marketing executive, she was hitting the gym 3 to 5 days per week, perfect macros. She really had everything dialed in. She ended up escalating her Tirzepatide dose from 2.5 milligrams all the way to 10 over 6 months, and she still only lost 15 pounds. She needed to lose another 110. So we ran blood tests and found out that she had sky-high levels of thyroid antibodies, which revealed she had Hashimoto's. We ended up starting her on low-dose naltrexone, BPC 157, and KPV, and our doctors also prescribed a flexible carnivore diet. Within 8 weeks, her inflammation levels dropped massively. So did those thyroid antibodies, her energy returned, and her weight loss resumed. She wasn't just a slow responder, it was really driven by her undiagnosed autoimmune condition, because that'll block everything. BPC 157 provides that systemic anti-inflammatory effect. With gut healing and tissue repair, it ends up healing the gut lining, reducing systemic inflammation from leaky gut issues where toxins leak through the damaged gut walls and into your bloodstream. Enhanced recovery, allowing more intense training, reduces inflammatory markers that impair insulin sensitivity. KPV is a selective anti-inflammatory peptide. It's a very potent anti-inflammatory compound made of just 3 amino acids. This reduces inflammatory markers. It improves leaky gut as well. About 70% of your immune system actually lives in your gut. Gut inflammation equals systemic inflammation, which equals impaired metabolism. KPV plus BPC addresses these at the source. Now, low-dose naltrexone, which is the immune system modulator. This will modulate, which means regulate in a better way, your immune system, which will end up reducing inflammation. Many patients also will report improved sleep as well. This is very, very important for autoimmune conditions like Hashimoto's, critical for metabolic health and cortisol management. And we use these 3 compounds together when patients have high inflammatory markers, gut issues, autoimmune conditions, even non-autoimmune inflammatory conditions like PCOS or what happens when you hit menopause. You can have the perfect diet, training, and peptide protocols, but if you have chronic inflammation, your body is going to resist fat loss. Addressing inflammation first creates a foundation for everything else to work. You're fasting, your low-carb eating, which will bring down your insulin. You're actually going to become insulin sensitive much faster by addressing the inflammation. If these underground peptide risks concern you and you want professional guidance with pharmaceutical-grade alternatives, not from research chemical companies or sketchy vendors online, but you want to work with a high-quality program, have my doctors and my coaches help you, book a discovery call with our patient advocates. We'll review your specific situation and create a safe, personalized protocol using these compounds and many options that I haven't even covered. I'll leave a link in the description where you can book that call, or you can just text the number on the screen. Otherwise, check out this video right there where I get into the muscle building peptides. Same type of structure like this, where I get into underground peptides, where I go over safe alternatives as well that are focused on building muscle. That video is right there. Check it out, guys. We'll see you later.